be going over the bones of the thoracic cage, which are the ribs and the sternum, and the bones of the shoulder girdle, which are the clavicle, scapula, and humerus.
Here we have the sternum in the anatomical position. We have the inferior, the superior, the anterior, and the posterior on the back. This part right here, taped in blue, this is the manubrium. So on the manubrium, I will lift this up so you can see. On the superior side, right here, we have the jugular or sternal notch. Then on the sides right here and right here, the red, we have the clavicular notches. Clavicular notches. Then these yellow right here, it would be here and here, and on this side. These are our costal facets for ribs 1 and 2, right there. Now we move down. This green part right here is the body of the sternum, and on the sides, right here, if all of these were blue, okay, these would all be costal facets for ribs 2 through 7, all along here. At the bottom of the sternum, we have here, the tip would be the xiphoid process. Here we have a rib in the anatomical position. We have the anterior, the posterior, the superior, and the inferior. Now, starting on the superior, this green is our superior border of the rib. Our inferior border of the rib is the blue right here, inferior border of the rib. Now, we also have an inner and outer surface of the rib. So, our inner surface of the rib and our outer surface of the rib. In the inner surface of the rib, we have that blue dot right there. That is representing the nutrient foramen, which is a hole that is on the rib. And the orange is covering our costal groove on the inner surface of the rib. Now, moving the posterior side closer to us, this is our posterior. If I were to grab this whole thing right here, this whole thing in my hand is the head of the rib. This green right here, this all the way around, is the neck of the rib. On our head, the head of the rib, we have those 2 red spots right there. The top one right here is our superior demifacet, and the bottom red one here is our inferior demifacet. Those are on the head of the rib. Now moving down, these 2 orange ones right here, these are tubercles. The top orange is our non-articulating tubercle, and it is rough, feels rough. The bottom one is our articulating tubercle, and it is smooth. This is the shaft. This is the angle where it starts to change directions. Here's the angle. And on the anterior, here we go, anterior, this edge right here, this is where our costal cartilage would be. This is where it would attach the costal cartilage, which attaches to the sternum. And that is our rib. We have here a clavicle. This is a left clavicle. If we were to orient ourselves with the sternum, the clavicle would be sitting like this in the body. So, orienting ourselves, this is our anterior side. This is our posterior. our medial and our lateral. And we have superior and inferior. Now, on the medial side, this flat surface right here, this is called our sternal facet. This is what articulates with the sternum. Now, if we turn it on its inferior side, right here, next to the sternal facet, this is our costal tuberosity. This border right here, this is our medial 2/3 shaft of the clavicle, and it is convex anteriorly and concave posteriorly. Now moving over here, this pink is the lateral 1/3 shaft of the clavicle, and it is convex posteriorly and concave anteriorly. This red tape that we have right here, this is called our deltoid tubercle. It sits on the superior side of the clavicle facing anteriorly. Deltoid tubercle. Now, turning the clavicle on its inferior side, okay, we have underneath, right here, subclavian groove. Subclavian groove. Next to that, this bump right here, this is our conoid tubercle. Conoid tubercle. And this orange line right here, this is our trapezoid line. All of these structures are on the inferior side of the clavicle. Now, on the lateral side of the clavicle, right here, this is called our acromial facet. This is what will articulate with our acromion process on our scapula. So this is the clavicle. Here we have a scapula. It looks like this. Okay. This is the anatomical position. It is a left scapula. We have the anterior, the posterior on the back. We have our lateral, our medial, and then our superior and our inferior. Now, let's begin by the borders. This border right here is our medial border. This border right here is our lateral or our axillary border. Our superior border is basically right here, superior border. And then we do not have an inferior border. Now we have angles. This angle right here is our superior angle. We have our inferior angle right here, and our lateral angle right here, where my fingers are pinching, would be our lateral angle. Since we are on the anterior side, let's start with the structures here. This yellow, this whole area right here I'm surrounding, this is all the subscapular fossa. This blue goes from here, and it also goes back on the posterior side, goes around here, because this is the neck of the scapula. Turning it on its lateral side here, we have right here, this whole circle here would be our glenoid fossa. Above and below it, we have some tubercles. So above we have supraglenoid tubercle, and underneath we have infraglenoid tubercle. Looking at it from a superior view here, right here, this pink, you can also see it like this, that is a notch. So that notch right there is called the suprascapular notch. That little pink right there. I'm going to turn it on its posterior view, and we're going to begin up here. This green, this whole area here, This is our supraspinous fossa, all in here. Underneath, right here, we have our infraspinous fossa. In between them, we have our spine. This is the spine of the scapula. Now, on the spine, we have a crest. This is the crest of the spine of the scapula. And we have a superior and an inferior lip. On the medial, now this is our medial, right? Medial side of the spine, we have here a smooth triangular space would be here. Now moving laterally, so right here, this big thing sticking out right here, this is our acromial process, or just the acromion. On the acromion, we have this pink right here. That pink is called clavicular facet. This is where our clavicle would articulate with. Now, if we turn it back to the anterior side, you can see this orange a lot better. Right here, this orange, that is our coracoid process. This whole thing is our coracoid process. And that concludes the scapula. Here we have a humerus. This is a left humerus. It is in the anatomical position where the head faces medially, and we have the anterior, we have the posterior, then we have the medial and the lateral, and we have the distal and proximal ends. Starting up at the top of the humerus, on the proximal end, medially, we have here the head of the humerus. Head of the humerus, right here. Surrounding the head, this orange, all the way around, we have there the anatomical neck. Now, moving more distally, here, this is our lesser tuberosity, or lesser tubercle. If we turn it, so now, it's like this. On the more lateral side, this big green, we have our greater tuberosity, or greater tubercle. This greater tuberosity has 3 facets. We have here our superior facet, our middle facet, and our inferior facet of the greater tubercle, or tuberosity. Now, in between these tubercles, or tuberosity, we have this blue line right in there, this blue line. This is called the bicipital groove, or the intertubercular groove. And this groove, next to it, there's 2 lines right here. The one that is touching the greater tuberosity, this is called the lateral lip, or the crest of greater tuberosity. The one touching the lesser tuberosity is called the medial lip, because it's facing the medial side, or it's also called the crest of lesser tuberosity. This dark blue right here goes all the way around. It is our surgical neck of the humerus. Let's do our borders. This border right here is our anterior border. If we turn on the medial side, that yellow, we will see our medial border. And then if we turn it on the lateral side here, that blue, this blue, is our lateral border. Now surfaces. Surfaces are opposite of borders. So if we have our anterior border here, our posterior surface will be on the back side here, posterior surface. And then if we have our medial border here, we will have our lateral surface right here, lateral surface. If we have our lateral border here, This right here will be our medial surface. Going up here, this big pink in between our lateral border and anterior border, we have our deltoid tuberosity. Basically on the posterior side of our humerus, right here, we have our radial groove. And that is the shaft of the humerus. And we move down. On the medial side of the humerus, this blue right here, that is called the medial supracondylar ridge. And then on the lateral side, we have our lateral supracondylar ridge. The more medial, right here, this will be our trochlea. Looks like this on the anterior side, and it comes around the back like this on the posterior side. Trochlea. Next to trochlea, laterally, we have capitulum. This is capitulum. Above each of these that we just did, there are some fossas. This fossa here above the trochlea is our coronoid fossa, and this fossa here above the capitulum is our radial fossa. Now, turning the humerus on the posterior view, we have a big fossa in the back. This is our olecranon fossa. And now we turn it back to its anterior view. And you can see on the sides here, the medial side here, we have a pink right there. That pink is called our medial epicondyle. And on the lateral side, we also have a lateral epicondyle, the pink. And lastly, on the medial side of the humerus, this yellow right here, this is our ulnar groove. Ulnar groove on the medial side of the humerus, because our ulna will be medially and our radius will be laterally when we are in anatomical position. And that concludes the humerus. This concludes the structures of the thoracic cage, which are the ribs and the sternum, and the bones of the shoulder girdle, which are the clavicle, scapula, and the humerus.